done, so we're coming back and we'll start with the gluteus maximus. I know some of you have already done that. So reach out to your classmates, ask them for some assistance if need be. So you're coming back. The gluteus maximus, of course, is the butt muscle. But remember, on a pig, it's coming out back here over the hump of the butt. So do not remove any fascia between the hip and the knee. There's a muscle in here we will get to called the tensor fascia lata. But don't take off any muscle in that area or any fascia. So you're looking for, you're back here by your tail. You're going to look and feel. There's a hump of the hip right across the back end there. And what you will find with the gluteus maximus is it's kind of a triangle. It tucks underneath the biceps femoris back here. So you're going to remove fascia just across that hump of the back of your pig there. And as you start to remove that fascia, remember you're doing the skimming technique. You're just going to go under the surface of the fascia. You're going to make that tunnel. You pull your probe back out. You're going to take your scissors and you're going to make some snips and just let that fascia remove to the side. So you can see that the gluteus maximus on bacon is not huge, but you can see the outline. It tucks under, like I said, the edge of the biceps femoris here, but you can see the outer edge is coming down at an angle. So my probe is under the gluteus maximus. Again, it coming up from the back of the hip and down over that crest of the butt and down into a point. So again, less fascia is more. You can always take off more fascia when you're trying to discover this muscle. It slips right down there into the pocket, and this is your gluteus maximus muscle. The biceps femoris is already pretty much done for you. It's the one that's running right along that edge. So here's the front edge of the biceps femoris muscle. We are going to end up finding the back edge as we find the semitendinosus, membranosus, and gastrocnemius. So you have this band of muscles that's tucked in the back of your leg. So the easiest way to start separating that is to take your probe up here by the butt. Right? If you still have some skin, you may have to move that skin back. And you're going to try to stay as center as possible along this muscle group. All right? And all it looks like is that it's all closed up. So you're going to take your probe and you're going to go and do that skimming technique. You're going to go straight down the middle there. And then you're going to take your probe out and you're going to cut through, and that'll start to open up the muscles that are kind of tucked in. So remember, on this edge is the biceps femoris. So behind it, you'll start to see a couple of muscle bands start to separate. The one that's over closest to the anus is the semimembranous, or I call it semimembranous, closest to the anus. So again, fascia to fascia is good. If I can see that slick, I can separate the semimembranous. The one beside it, closer to the biceps femoris then, is the semitendinous. And so those two should separate very gently from each other. Now, as you continue down the semitendinosus area, you may have to cut a little more in the tunnel. And the gastrocnemius muscle, he's kind of deep. And so he is down in a pocket. So as the semitendinosus gets moved over, you are going to be looking for a fat calf muscle, basically, and you're going to want to run your probe on both sides of this muscle that's down here in the pocket. It will attach to your gastrocnemius right here at your heel, or your calcaneus right at the heel, because this is the gastrocnemius muscle that's down here in this pocket. So basically he's deeper. He's got two sides, so just make sure you can run your probe on both sides. So the biceps femoris, the gastrocnemius muscle down in the pocket, the semitendinosus, the semimembranosus or membranous closest to the anus. Now the tougher one in this mass, you can see the gracilis is coming right here from the groin up through the leg, this sheet that's on the very outside. The harder part of the gracilis is separating it from the semimembranous. So we have our semimembranosus or semimembranous. You're going to want to follow the edge and see if you can create a little cut along the edge where the muscle separates, and then a gentle location. I'm not sure that I have mine here yet. So there I've got a little pocket. I'm going to take my scissors and run just a little cut at the top of that pocket, because all I want to do is slide my probe in between, and again it's really thin, the gracilis is, so you don't want to stretch it too much. But you're trying to get your probe under the layer of the gracilis on top of that semimembranous. And so that's the sheet that you have right there. You don't want to have to stretch it too much or you will cause it to rip. Again, you have another one, but you don't really want to have to go skin your other side. So there we had the gluteus maximus, biceps femoris. We now have the semimembranous closest to the anus, the semitendinosus. The one down in the pocket is the gastrocnemius. And then we also have the one on the outside edge, which again is your gracilis muscle. So we're almost done, actually. You might think, no, we're not, but we're getting there. So now you're in the inside of your leg where you had your gracilis. Now mine's open, but you will have a layer of muscles that's kind of holding it like a pocket. What you want to do is not open up your organs. We don't want to go that low, but if you will lay your finger on the crest of the hip, down along the knee, and very gently use that as your guideline, and don't cut over towards your finger, but basically open up that muscle by making a snip through there. All right, and that'll open up this pocket. You may have to clear a little bit of fascia with your probe, and that'll leave some muscle that was holding it, like there it was held, so that's holding your leg together. Lay your finger and then cut that edge, because that will allow you to find this tensor fasciolata muscle. And it's basically just muscle up here at the hip. All right, and it turns into fascia. That's where the name fascia lata comes from, across the knee. So the easiest way to get that one found is if you now look inside that edge, you can see the muscle bands coming along the edge from the top. If you take your probe and look underneath to the top and just poke a hole where that edge is, then you have the tensor fascia lata done, because then you can now show me that that muscle is that band right there. So just go underneath it and kind of look to see where it's going to pull up. Again, if you have a smaller pig, those muscles aren't as well defined. We have a muscle called the sartorius. Right, so to find the sartorius, remember you've got the gracilis band that's running right here on the inside. The sartorius is right in front of it. So we have this band right here. So there's our gracilis. Then there's kind of a gap. Usually you can see some blood vessels. Bacon's blood vessels aren't real good. And there should be this band that comes up right in front of the gracilis. And there's typically, like I said, a couple of blood vessels that are right there. Mine aren't very dark for you to see, but now I'm under the sartorius muscle right there. So the last couple muscles we have are the obliques. From what you've been learning, the obliques will compress the abdomen and aid in flexion of the trunk. So the outside right here along these lower ribs, those are your external obliques. So they're found. Now, the external oblique sits on top of the internal oblique. So basically, it's kind of like skinning. you're going to take that little layer and make a small pocket by just gently pushing your thumb under the external oblique up towards the ribs. So I've lifted that external oblique layer, which means the layer below it that I just exposed under the pocket is the internal oblique. All right, so external sitting on internal. And then the internal is basically sitting on the transverse abdominis. Now to do the transverse abdominis, they are the last barrier between you and your organs. So you want to go in here in this corner where you can see the external oblique is kind of turned to fascia, and you're going to make a pocket just underneath the external or the internal oblique. So I just cut my pocket. Now I'm going to lift that internal oblique off the layer it's sitting on, which is the transverse abdominis. And we know transverse means that the fibers should be running side to side. So once you have that fascia kind of pulled up, and not the organs pulled up, just the fascia, so don't go deep, don't be puncturing, you should be able to see the external fibers here, the internal oblique fibers here. Now you have the transverse abdominis fibers running this way towards the midline. So external, internal, transverse. The last muscle, yay, I said it, the last muscle is the rectus abdominis. Rectus abdominis, you know, is going to go from the groin up to the chest. We're only going to find it down here in this lower position. Where the transverse fibers go sideways, the rectus fibers go up and down. They go straight up and down parallel with the body. So in order to show those, they are right in the middle of the abdomen area. Again, we're not digging underneath them. You're simply looking for a change in direction. So the transverse are going sideways, and then my fibers right here are going up and down towards the midline. You may have to kind of reposition your pig a little bit so you can see, but what you're looking for is where do the fibers start going up and down rather than across. And it should be right in line with the center of the body. You don't have to find them any farther than right in the surface area. You may want to take a little bit of this fascia layer. Again, make a pocket in the fascia. And then you can kind of see that those fibers are moving up and down versus side to side. So again, external oblique, internal oblique, transverse abdominis, rectus abdominis, tensor fasciae lata, the little sartorius band, which was right there in front of the gracilis, your gracilis. Not the last muscle, I kid you not. Tibialis anterior is one that's fairly simple to find. It sits on front of the tibia. I kind of forgot he was hanging out up here. So there's a band of fascia that's going to be across there that's pretty thick. You're going to get up underneath that and cut it so that you can see it's like a teardrop band right here on top of the shin or the tibia. So tibialis anterior, the front of the tibia. Now the tibialis anterior, once you get the actual muscle exposed, there is a ring ligament, so a thick band holding it here at the ankle. Don't cut that ring ligament right there, but what I want you to do is to expose these little tendons that are going down to the metatarsals to hold him in place.